About it? Right. So your HbA1c tests the average blood sugar level in your blood for the last 2 to 3 months. So after you do your HbA1c, it gives you a percentage of how much glucose is in your bloodstream, right? And that value will be for the past 2 to 3 months. Okay? So for this test, you will fast also, right? But if you are not diabetic, your normal range is 4% to 5.6%. So if you do your HbA1c and you get that range, then it means you are not diabetic. Okay? If your HbA1c reads 5.7 to 6.4%, that means you are pre-diabetic. Right? So just like with the fasting, with pre-diabetes, it does not mean you're diabetic, but it means that you have a greater risk of developing diabetes if you do not change your lifestyle, right? With the HbA1c, if you are diabetic, you will get a reading of 6.5 and more. So 6.5 and over is your percentage if you have diabetes, okay? The last test that we do here in Trinidad is the glucose tolerance test. They mostly do this in maternity with pregnant women, right? But if you're in a private institute or if they are trying to figure out if you are diabetic, they may do this to a regular adult, right? So what the oral glucose test does, it identifies any abnormalities in how your body handles the glucose that is absorbed into it, right? So for this test, you will be fasting for 8 hours. You reach by the doctor, they take your blood, they check your fasting blood sugar first, right? Then they will give you a cup of a sweetened drink, not soft drink or anything like that. They're gonna pour pure glucose in water and make you drink it. After you drink it, you wait an hour. They will check back your blood sugar, let you sit again for another hour, and then check back your blood sugar. Right? So these values here will be after the 2 hours of having that glucose drink. Okay? So after 2 hours of tolerating a sweetened drink, your normal value, if you're not diabetic, should be less than 140. Okay? If you're pre-diabetic, it will be 140 to 199. If you are diabetic, it will be 200 and over. Right? So if you are diabetic, remember you're not producing enough insulin or you're not utilizing the insulin, so your blood sugar wouldn't go down. It will just remain in your bloodstream. The insulin not taking the glucose into your cells to actually be used for energy. So it's just remaining there.
Saying that, okay, you check your blood, it's 126, but you're young. Is it too late? If you're just young, can you recover from it, or is it actually just slow down?
It can be reversed with diet and exercise, right? You're talking about the fasting blood sugar?
So I'm talking about during the test itself. You reach the diabetes stage of 126, and you're young, and you change your eating habits.
Change your eating habits and start exercising, and it can reduce it, right? If you let's say you do a fasting blood sugar and it read like 140 something, more than likely a doctor will want to start you on medication. To be honest, that's the first avenue doctors tend to go, is medication, right? Because sometimes it's too late. By the time we actually reach the doctor, we feel in certain ways, and then we will just put it off until our body actually crash, and we have no choice but to go by the doctor, so usually it's too late by then. So they will resort to medication. But if you are aware of your body, you're doing your tests on yourself regularly, and you're able to pick up any abnormality before it's full-fledged diabetes, you can reverse it, right? So there are different types of diabetes mellitus, right? So you're all familiar with hearing about type 1 and type 2 diabetes, right? So type 1 diabetes results from the failure of your pancreas to actually produce enough insulin, right? So usually children is affected by type 1 diabetes and they maintain it through the rest of their life because something is genetically wrong with their pancreas, so they're not producing the insulin. So persons with type 1 diabetes will have to live on insulin for the rest of their lives. Okay? So the cause of this is unknown, but they know that is your body, your immune system really fighting itself, right? They don't know what causes it, but it's just how your body works, right? And it was formerly known as insulin-dependent diabetes or juvenile diabetes because, like I said, it usually shows up in children, right? If you're an adult and in some cases where you were in an accident and your pancreas was damaged, they will consider you having type 1 diabetes because it's now your pancreas not working properly, right? The type 2 diabetes is where you have insulin resistance or your body not producing enough insulin, pretty much. So sometimes you'll see a lot of people they're eating so much that their pancreas cannot produce enough insulin to meet the demand of how much you're consuming. Okay? Or after a while, your body just not recognizing the insulin that your pancreas is producing. Because of that influx of carbohydrates and sugars that you're adding, you overwork the pancreas pretty much. Right? So the primary cause of this type of diabetes is excessive body weight and lack of physical activity. Right? This was formerly known as non-insulin dependent diabetes and adult onset diabetes. Right? Everybody good so far? We can move on. Yeah? So we continue with different types of diabetes and we have pre-diabetes, right? So pre-diabetes is where your blood sugar is a little higher than normal, but it's not high to be considered diabetes, right? Normally you might see little changes, you might get few of the symptoms of diabetes, so it's always good to pay attention to your body, know what is normal for you. I'm being honest, mostly women are better than this than men. Sorry to say hawkish, but men tend to wait until they get all the symptoms and they're ready to drop down before they go and see any doctor, right? And then we have gestational diabetes, which is diabetes in pregnancy, right? Remember, pregnancy does mess up your hormones on a whole. Insulin is a hormone, right? So since pregnancy is a whole hormonal change, insulin is affected as well, and you tend to have higher blood sugar levels in your pregnancy, right? Which puts you at risk for diabetes further on in your life. So when you get gestational diabetes, you are at a greater risk of developing diabetes later on in your life as well, right? So the signs and symptoms of diabetes that we need to pay attention to. Increased hunger, right? Increased thirst. So because our body has our blood has all this glucose floating around in it, which is not supposed to be there, it's supposed to be in our cells, our brain triggers our sensation to drink. We want to drink more because your brain is trying to dilute that high concentration of glucose in your blood. So if there's anything that is off, our body, our brain tries to signal something else to counteract that abnormality, which usually causes another symptom, pretty much, right? So then we have weight loss, right? Remember, we're using glucose for energy. If the glucose remains in our blood and we're not utilizing it, our body will go to another store, which is fat or protein stores. That is why you will see persons with diabetes losing weight, because they're not utilizing the glucose remaining in your blood. So your body goes to another store of energy, which is your fat and your protein. So that's why you'll see diabetics dropping weight. So they'll be big at one moment and then they just get skinny after a while, right? Then we have frequent urination. Well, you're drinking more, So obviously you will be passing more urine as well, right? You have extreme fatigue. You're not utilizing the glucose for energy, so you will feel tired. Protein and fat is not a good source of energy, right? It will keep you going for a moment, but it will not give you that boost that glucose does, okay? Then your wounds will not heal. So if you notice, diabetics, like the poorly managed diabetics, always have a bandage on the foot. They always have some issue with the toe or something like that, right? Because their wounds don't heal because of that increased level of glucose in the blood. It hinders that process, right? And as you have increased glucose levels, you're at a greater risk for inflammation as well, right? You have decreased sex drive, right? Increased glucose affects your whole body mechanism as well as your vascular system. So your blood flow and everything will be affected if your glucose levels are high. You will have dry, itchy skin. Your body is taking the water that you're putting in and trying to dilute your blood, which is high in glucose. So it's not going to go to other areas of your body, like your skin, to be hydrated. So after a while, you will have dry, itchy skin. Okay? Blurred vision. Remember, it's affecting your vascular system. It's affecting how your blood flows through your body. Right? You have urinary tract infections. Increase in glucose is like, how can I put this? It's like a hotel for bacteria. They're glad to come. Right? So it puts you at a greater risk for urinary tract infections. You have erectile dysfunction, like I said. It affects your blood flow. Right? So usually men who are diabetic have issues in their love life because of this erectile dysfunction. Right? With women, we are at a greater risk of yeast infections with diabetes. Same thing with the urinary tract infection, high glucose levels. We are not fully hydrated, so any sort of bacteria is welcome to affect you, right? And then we have numbness and tingling in the feet. So yes, you have wounds that don't heal, but if you have numbness in your feet, a lot of times with diabetics, they get cut and they don't even realize. So the cut not healing properly, they didn't feel that they get a cut. And then later on they realize that they're getting a smell from their feet, or if they look at the spot, they see it turning black or green. And that is why a lot of diabetic people that we're seeing in Trinidad will end up losing a toe. You see, they're cutting off half of their foot, they're cutting off half of their leg because the bacteria spread going up into their body, which could actually cause death. Okay? So we have high blood sugar versus low blood sugar, right? So the blue side is called hypoglycemia, which means low blood sugar, right? Symptoms of low blood sugar is sleepiness, excessive sweating, you're looking pale, right? Lack of coordination, you're stumbling when you're trying to move, you can't think straight. Irritability, you're angry, you can't talk to no one. And hunger, right? So just like you say, a hungry man is an angry man, your blood sugar low, you can't focus, you can't think straight. Because remember, glucose is our brain's only source of energy. Okay? And then we have hyperglycemia. Symptoms are dry mouth, right? Increased thirst, blurred vision, weakness, headache, and frequent urination. In both instances, if they are not treated as soon as possible, it can result in the person becoming unconscious and going into a coma. Right? So you could go into a coma because your blood sugar too low, or you could go into a coma because your blood sugar too high. Your body just can't respond anymore because the levels are either too low or too high. Right? Normally with hyperglycemia is either if you're diabetic, you already know you're diabetic, or you are diabetic and you didn't realize that you are. This tends to happen. Hypoglycemia can happen to anyone if you're not eating properly. Right? You know, people going on the hunger diet, the Vebran diet, something like that. they're doing intermittent fasting and they're not doing it properly, you can go hypoglycemic.
I don't know if I'm saying the right thing, but either one of them can you get minor strokes?
More so with the hypoglycemia. More so the hypoglycemia, because if it's untreated and your body remains in this stage like you're getting coma and you remain like that for too long, your brain is starved of energy and blood supply, so you can end up having a stroke because of that. Right? So the different risk factors for each type of diabetes. So for type 1, you're either a child or a teenager, or you have a parent or sibling with diabetes mellitus, right? For type 2, you're overweight, 45 years and older, but that needs to change because in Trinidad we have people being diagnosed with diabetes at 20 years of age now, right? Family history of diabetes, race, not being physically active, having or had gestational diabetes, you're pre-diabetic, or you have high blood pressure or high cholesterol, right? With gestational diabetes, it's either that you're overweight, you're older than 25 years of age, you had gestational diabetes in the past in your previous pregnancies, you have a family history of type 2 diabetes, or if you have polycystic ovaries, right? So you know polycystic ovaries is a hormonal issue with women. And anything to do with hormones, it will affect your blood sugar as well, right? So complications of diabetes. So all this could happen to you if you are diabetic. So you can either get heart disease, a heart attack, or a stroke. You can get kidney injury or kidney failure. You can have vision loss, like cataracts, glaucoma, can happen during if you have diabetes. You can end up with hearing loss. You can end up with vascular injury because of poor circulation. Your foot can be damaged. You can have a missing limb, right? You can have skin conditions, depression, or dementia, right? For diabetes. First one being diet and exercise, which is very important, right? So we need to change our diet, cut down on the amount of simple sugars that we tolerate, like the soft drink and all of these, when we have Linda's right here, don't talk too long. All the cake, all these sweet pastries and stuff like that, right? So you want to cut down on your sugar, you want to cut down on your fats. You want to try and introduce more complex carbohydrates like provisions and stuff to your diet, right? You want to eat lean proteins like breasts and chicken breasts and fish and stuff like that. Cut down on the pork, the beef, right? You want to eat a lot of vegetables and have fruits high in fiber like apple, pear, pomsity. The fruits that are not high in fiber, the sugar will just remain in our body. So like banana and melon are not good fruits to actually have if you're diabetic, right?
What about grapes?
Grapes? Grapes has a lot of water in it and it's a simple sugar as well, but it has a lot of fiber, so I think grapes are good. You can actually eat grapes, right? But like I always say, everything is good in moderation. Our issue is that we overdo things, right? We eating the grapes sweet, instead of we eat 10, which is normally like a serving size, it's a whole bunch. We eat the whole pack of grape because it tastes good, right? We eat beyond our serving sizes. That is our issue, right? The next thing, you want to exercise. So the main form of exercise that you need to do if you're diabetic is cardio. You want to burn out some of that glucose and stuff from your body, right? In terms of medication, treatment will be insulin. So insulin is the last resort usually in terms of treatment for diabetes. They will go to oral medication first. If that is not working, then they will resort to insulin, right? So there are different types of oral medications. Either you take it once a day, you take it twice a day, you take it 3 times a day. It all depends on how they are able to regulate your blood sugar. If the medication not working, they reach 3 times a day and that's still not working, they will resort to the insulin. Right? The insulin could be after every meal. It could be once a day. It could be twice a day. It all depends on how your body responds to the treatment. Okay? So don't feel because if you hear somebody had diabetes and they get insulin 3 times a day, and if you are diagnosed with diabetes, you expect that to be the same lifestyle for you. It's not the case. It all depends on how your body responds. Right? If you are taking medication and you have not changed your lifestyle or your diet, they will just have to be giving you more medication. You might end up rewarded and have to be giving you insulin every 2 hours. Right? Diet and exercise is most important with diabetes. And that is the one thing we focus on the least. People prefer to take medication than change their lifestyle. Right? So, any questions? No? Y'all understood what I said? Everything? To some degree? Yeah? Right. So, we have 4 lovely PTSC bottles. You taking back? I'm going to ask questions and whoever answer getting a bottle. You get a prize, pretty much. So you taking part? Right, so I'll ask the question and whoever raised the hand first will get the answer, right? So my first question is, can anyone give me 3 symptoms of diabetes? Lovely. These are the first prize is given. So which one you want? The blue, the pink, or the green? Green? You're the first woman to choose that color other than pink. Well, I'll give it to you after, right? So once you answer, once you can't answer again, it's 1 prize per person, right? So my next question is, can anybody tell me what is insulin? Just 1 word. What is insulin? Blood sugar, right? So what is it? What is the actual term for it? 1 word. You're right, then you'll get your prize. I just want to know what is 1 word. 1 word. Our thyroid gland produces it. Pancreas produces it. It regulates the function of our body. Well, we don't have an idea, but it's a hormone. Right? So one thing to remember, insulin is a hormone. Right? Which one you want? Blue? Nice. Right. So after the bottle's gone, you either have a chance to win pens that have sanitizer in it. So it's a sanitizer and a pen in one. Or you could win some kind of charger thing. But it's an iPhone. So you don't have an iPhone, you can right? So my next question, the Mukesh still have a chance, right? This is a real easy question. Can pre-diabetes be reversed? Mukesh said good. Right? Which one would you like to have, Mukesh? Blue? So we have pink remaining, right? So we need ladies nuts, so they can get the pink bottles. Next question. Which complex organ only uses glucose as its source of energy? Nice. Answer ready, boy. So I guess you take anything? So, Wendy.
Ladies and gentlemen.
So the only thing we have remained is the pen. It's sanitizer the pen, right? So I'm just asking one last question, right? Can you all give me 2 symptoms of low blood sugar? Anybody? Uh-huh. Is hunger you say just now? Yeah, you may feel dizzy, yeah. You're feeling tired, you have no coordination, you can't concentrate. Just think of all the symptoms you just feel when you're real hungry. And that's low blood sugar, pretty much. Nobody can talk to you, you're irritable, you just want to eat and biting at everybody head in the come and ask you something, right? That's, if you notice, like when you're studying, you eat a lot when you're studying. Because your brain asking for the glucose to energy to continue studying. Right? So, it makes more sense now, right? So, don't starve yourself if you're studying. Feed your brain, but feed your brain good things. We tend to eat the bad things when we're PTSC, right? So, thank you very much, everyone, for being here and listening to my presentation. I hope that you make the changes in your life to prevent yourself from getting diabetes. Just to touch on our situation right now with COVID, if you notice, they keep announcing deaths. We're getting a lot more deaths every day. And the main issue here is that because of comorbidities, right? One of the major comorbidities, actually the cause of 85% of the deaths in Trinidad, is diabetes and obesity. Right? So that shows you, because this diabetes affects the way your body responds to everything. It decreases your immune system. So when you get COVID, your immune system is already compromised. You already have a set of excessive weight, especially when you're diabetic, most of your weight will be in your belly area. So it actually decreases your ability to breathe properly because of that extra weight in this area. So your immune system compromised, you're overweight, you have excessive fat and weight in the thoracic area, so you will not breathe properly. And that's why most persons who have passed away are either diabetic or obese. Right? So it's something to take note, especially if you're considering vaccination. And if you're at risk for diabetes or you're not sure if you're diabetic and you're getting symptoms, check yourself. Think about what is best for you at the end of the day, right? So thank you very much and enjoy the rest of your day. Let me hand out the prizes one time, don't forget.